Welcome back to the Special Good Day PA. Joining us is Dr. Sarah Horvath, Assistant Professor of Obstetrics and Gynecology at Penn State Health. Let's talk about miscarriages, because miscarriages are often not talked about. They're so devastating to women and men who are planning a family. How often do they happen?
That's a great question. So it turns out that miscarriages are an incredibly common experience. And you're right, while they can be incredibly devastating for folks, they happen more often than anyone really talks about. So about 15 to 20% of pregnancies will end in miscarriage, and that rate goes up with age. So for those of us who maybe put off fertility in order to have a career first, or want to be a little bit older when we start our families, that number can be even higher. The truth is that we all know someone who's had a miscarriage because it is such a common experience, and it's one that we should be thoughtful about when we're talking in the larger worlds.
So we all know somebody, probably whether we know it or not, because it's often not talked about. But why? What causes miscarriages?
So most of the time, we don't even have a reason for a miscarriage. We know that about 50% of them will be caused by some sort of genetic abnormality, but that's a genetic abnormality that's not something that's going to continue to happen in future pregnancies. When you think about the process of creating an embryo, there are many, many steps that have to happen in between, and something can go wrong at every little step along the way. And so sometimes when you start to think about it, I actually get a little bit overwhelmed by the fact that so many of us actually have ongoing pregnancies. There are tests that can be done to see if there is a genetic reason for what happened, and if you're in that small percentage of folks for whom that would increase a risk of a genetic anomaly in the next pregnancy as well. But because miscarriage is so incredibly common, we often don't even do those genetic tests on a first miscarriage. We would wait until a second or a third before we would start that kind of testing.
So the emotional toll of it, I know, is just so sad and overwhelming. Also the physical toll, like if a woman experiences a miscarriage, how long should she wait to try to conceive again?
That's a great question. Early miscarriages in the first trimester, you really should give yourself about a week for physical healing. I think that the greater toll, like you said, is really the emotional toll. And so what I tell all of my patients is beyond that 1 week, you can start trying right away if you're emotionally ready to do that. If you're not emotionally ready to get started again, then it's totally fine to take a break. You can come and talk to us about contraception and ways to give yourself time if you do want to have some more emotional healing time. But certainly you're physically ready within a week or so if you're feeling up to it. And then it's entirely up to you and when you feel prepared to continue on.
So after miscarriage, what types of conversations should a woman be having with her doctor, maybe before conceiving again?
That's a great question. So anybody who has modifiable risk factors, meaning those things that Dr. Paulai was talking about, right? If you have other health conditions, you should be talking about optimizing those before trying to get pregnant again. If you don't have those things, then you want to be thinking about things like smoking cessation for folks who are smoking, weight loss for folks who are overweight. But other than that, really just continuing your prenatal vitamins, optimizing your own well-being, both physical and emotional, and then giving it a try when you're ready.
If someone's looking for support, what resources are available after a miscarriage or loss of any baby, a child?
I think the most important resource is the folks that are your emotional supports already, right? So your friends, your family, those folks around you who've maybe had this experience but never shared it, again, because it's so devastating and there can be some stigma around it. So finding those folks that are the supports in your life anyway and really using them. There are also many, many different miscarriage support groups out there, and you can, go online and find the folks that sort of align with your own life circumstances and your own way of seeing things. And finally, you can always come in and talk to us. We are more than happy to be your emotional supports and help you move forward to have the family you want.